I want to explain torch infections really simply. So torch infections are congenital infections that the mom passes on to the baby. T stands for toxoplasmosis. O is other, so that's like syphilis and parvovirus B19 and varicella zoster virus, and that's O. R is rubella. C is cytomegalovirus. H is the herpes simplex virus. These torch infections are going to be seen in the baby past through pregnancy. And you have to look at the antibodies to know that they are present. So IgG antibodies, they can cross the placenta. IgG for go, cross the placenta. IgM antibodies, too big. M stands for make. You have to make it in the newborn. So if you have a torch infection, you'll see growth restriction, microcephaly, hepatosplenomegaly, and a blueberry muffin rash that's very, very pathognomonic for it. So IgM, made by me, IgG from the grown-up, from the mom. And so you'll see a neonate with all these little symptoms and illness and fever, and there's going to be a serological pattern that you have to look out for. In this case, it's going to be B is our correct answer, maternal IgG, neonatal IgG. So those antibodies are going to be passed from the mom to the baby, gets go, passes through the placenta, made by the grown-up, and then the neonatal has an IgM positive reaction. And so let's explain why the mom wouldn't have IgM if she had it. That might be a question you have. Well, the antibody timeline goes like this. IgM is the first antibody that the immune system makes when it encounters an infection. It shows up early, within a week or so. Then over time, the immune system switches to IgG, which is more specific and longer lasting. And so IgM will fade within a few weeks or months, and then IgG will stick around for years or even for life. And so if the mom was infected early in pregnancy, or even before she got pregnant, her IgM would be gone by the time you're testing. She would only have IgG. And so why does the baby have IgM? Well, it got infected in utero while their own immune system was developing, and so the baby has IgM. That means that the infection happened recently enough that the IgM immune system is still responding. So hopefully that clears up any questions we might have. Basically, IgM positive means that the baby made it themselves. IgG positive is passive transfer, and that's seen with torch infections. Hopefully this is helpful. Torch infections were kind of hard for me to grasp, and so hopefully this video just kind of condenses that. If you liked it, like and subscribe. If you didn't, then unlike and unsubscribe.